is Dean Rocco. I'm an attorney in Los Angeles, California, and I'm coming to you today on behalf of the Insurance Board to talk about the pandemic, where we sit today, and some of the key developments around pandemic preparedness planning and returning to worship and returning your employees to work. We're going to talk about a number of things today. First, we're going to start by discussing things at the federal level, where things stand with OSHA and the CDC in terms of structuring return to work or return to worship programming. And then we're going to explore some of the material changes that have happened at a state level, and in particular, California, where we've been very busy over the last 3 or 4 months, updating and restructuring the way things are being handled in this state. And then we're going to close by talking about some of the other related developments around COVID-19, including employee benefits, supplemental sick pay, things of that nature, and then also talk about the way things are going to look in the days ahead with the onset of the vaccine. So let's get started. Whether you're in California or not, you do need to be doing some form of pandemic preparedness planning, and you can go to OSHA as a starting point. Nationally, its guidance for preparing workplaces for COVID-19 outlines basic steps that every church can take to reduce the risk of employee exposure to COVID-19 at work. It principally suggests that churches should develop an infectious disease preparedness and response plan, and that's sort of the theme of today, and we're going to be talking about it in more depth. Implementing basic infection prevention measures, developing policies for prompt identification and isolation of sick people, developing and communicating workplace flexibilities and protections for your workers, and implementing engineering and administrative workplace controls that would prevent the spread of COVID-19 in the facility. Most churches are going to be considered medium exposure risks because they have frequent or close contacts to persons who might be infected with COVID-19 but are not known or suspected to be positive, which would be members of the public that are coming in and out of your church. For employers of that type of a medium exposure risk, OSHA typically suggests using physical barriers when it's feasible, offering face masks to your employees and to congregants, requesting members of the public to remain away while sick, so putting up postings that remind people of what the symptoms are, encouraging them to please not come into the facility if they're having any symptoms or they have a fever, implementing measures to preserve social distancing. We'll talk about that some more in the context of a church and what you might be doing as you're outlining your own preparedness and response plan. When you go to OSHA's resources, you'll see not only their guidance for preparing workplaces for COVID-19, but they have a guidance for returning to work, which provides a little bit more detail. And there's also additional resources related to business travel, hand washing practices, the use of face coverings, and other items that you might consider including in your pandemic preparedness planning. And if you are going to that website, you're going to go to the guidance by industry, and you'll see that at a federal level, there is not one that's set for places of worship. So you can just go into the All Industries tab and see what they have there. There's posters, documents that you can put up around your facility, and then thoughts or ideas, guidelines or suggestions that you can fold into your pandemic response and preparedness plan. Beyond OSHA, there is the Centers for Disease Control, the CDC, and it routinely updates its guidance for business and employers with additional information that you can use as you lay out your protocols, things like symptom checking and employee screening. There's guidance around those topics, updates to policies that facilitate the isolation of sick or symptomatic employees. The CDC has traditionally been the agency that will outline the amount of time that someone needs to be away from work, be away from a church before they can come back to work or come back to worship. Those time frames have shrunk over time. You may recall that there used to be a time where somebody could test negative for COVID and then come back. There's been a move away from that. So you want to go to the CDC primarily as a first step to determine sort of what those symptoms are, what those isolation procedures are, so that your policy, your procedure is up to pace with the current understanding of the pandemic. There'll be information on the CDC's guidance for businesses and employers about cleaning and disinfecting procedures and what the current knowledge is around what works there. And then other information to implement training for workers on COVID-19 risks and otherwise conducting thorough COVID-19 hazard assessments. Specific to churches, the CDC has published a guidance for communities of faith, and you can find that on the CDC's website. And it provides some specific ideas for churches looking to promote healthy hygiene practices, encourage mask wearing, intensifying cleaning measures, promoting social distancing, and undertaking other measures to limit exposures during community worship. I would say that for this program, if you're not in California, please keep listening, because if you follow along with what we're doing there, what's been put out in California provides some even more specific suggestions than what was put out by the CDC. And there are some ideas there that, again, you can borrow as you're going through your planning, even if you're not necessarily in California. With that being said, beyond reviewing those materials from the federal agencies, as you're building your pandemic preparedness plans, you should again check to see whether there are any existing state or even municipal guidance in your neck of the woods that are going to impact your planning. There might be forms, there might be postings that you need to be putting up. As we're going to talk about specific to California, there might be other suggestions, recommendations, or even requirements that you need to fold in to what you are doing. So let's talk a little bit about California and what's been going on over the last several months. The first place that I think we should start is Assembly Bill 685. You may see reference to it as AB 65 if you're Googling along the internet or looking into the state's websites. AB 685 codified what was then known as the COVID-19 Employer Handbook for California. And this is a really nice document that you can look through to understand what your requirements are and get some ideas about how you're putting your pandemic preparedness plan together. The document itself reiterates some basic tenets for pandemic preparedness planning, some of which we've already talked about and sort of echo what's happening at a federal level. First, it asks that employers of any type perform detailed risk assessments and create work site specific COVID-19 prevention plans. What that means is you need to actually go into your facilities and see what goes on there and determine what needs to be done to either make modifications, install barriers, turn things off, close areas off, and do other things to prevent the spread of COVID-19 within your workplace and your facility. The employer handbook also calls for employers to train workers on how to limit the spread of COVID-19, including how to screen themselves for symptoms and when to stay home, telling them when to stay home. As I mentioned, it asks for us to set up individual control measures and screenings. It calls for employers to put disinfectant protocols in place. It calls for employers to establish physical distancing guidelines, or social distancing as it's commonly known as. And it calls for California employers and facilities to establish universal face covering requirements. There are some allowed exceptions for persons with disabilities, and those are spelled out there. But generally speaking, if you're going to have people coming back to work or coming back to worship in California, that's something that's going to need to be in place. Now, beyond some of those concepts, which really have been around since the summer of 2020, the COVID-19 Employer Playbook really introduced a new concept around employee notification requirements. There, for the first time, it sort of required employers to notify employees when there's been a workplace exposure. So upon receiving a notice of a potential exposure to COVID-19 at the workplace, in other words, learning that an employee tested positive, or a public health official notifies you that one of your employees has been exposed, you must provide written notice to all your employees and employees or employers of subcontracted employees of the exposure. You then need to provide disinfection and safety plans to implement in that instance to make sure that the workplace is cleaned up and disinfected. And you need to provide potentially exposed employees with information about COVID-19 related benefits to which they might be entitled. And we'll talk about that towards the end of the program today in terms of where some of those COVID related benefits have changed, both at a federal level and at a state level as well. In addition to employee notification requirements, the employer handbook also introduces some obligations around public health agency notification. Upon learning of an outbreak, and that term is defined, we'll talk about that, you in California must notify your local public health agencies of the names and number and occupation and location of qualified individuals within 48 hours. In this context, an outbreak means 3 or more lab-confirmed cases within a 2-week period from employees in a different household. And it's been really the case that since we've seen the uptick in community spread here in California, a lot of employers have been hitting these employer notification requirements and hitting these local public health agency notification requirements, not because of widespread COVID-19 transmissions within the workplace, but people are going out and catching COVID-19 in the community and then bringing it to work. And those cases, when they are caught in the workplace, can trigger these notification requirements. So don't fall complacent and think, well, I don't think this is happening in my workplace, so I don't have to do these things. If you have those lab tested or lab confirmed cases, and you have 3 or more within a 2-week period, you do need to do these notifications. Qualified individuals are those individuals with confirmed cases through positive tests or medical diagnoses, or those that are ordered to isolate by public health officials, or who have died of COVID-19. Let's also talk about the COVID-19 industry guidance that we have here in California. As I mentioned at the beginning of the program, at a federal level with OSHA, we don't have something that's this specific. The CDC does have some guidance, but it's nowhere near as specific as what we have here in California. If you look at the COVID-19 industry guidance for places of worship and providers of religious services and cultural ceremonies, you'll see echoes of a lot of what we're already talking about in terms of having pandemic preparedness plans, training employees, that sort of stuff. But layered into it are some key requirements and even recommendations for churches and religious institutions that are returning to work and returning to worship here in California. And that's been updated, and I think the last time I saw it was updated was December of 2020. So if you looked at it before, it would behoove you to go back and routinely every several weeks go back and look to see if there's been any updates, and also go into your place of worship or go into the workplace at your facility and see if anything's changed or if anything needs to be tweaked. Some of those things that you'll see in the industry guidance that I think are helpful for anybody, whether you're in California or not, would include some of the prohibitions around singing or chanting indoors and the limitations around such practices in outdoor settings. That may not be something that you fold into your religious practices outside of California, but if you're in California, that's something that you need to adhere to. There's limitations around indoor attendance at services to 25% of your building's capacity or 100 people, whichever is less. And there's recommendations around offering additional services times to limit the number of guests that attend at any given time. That's the sort of thing that I think you can fold into practices whether you're in California or not. If you have a large congregation and you're having trouble limiting social distancing, it's very easy to roll out another service or two, and thereby you limit the number of people that are coming in at a particular given time. As mentioned before, in California, we require the use of face coverings. You'll see that in the industry guidance here in California. You'll see encouragement for remote services, dictates around workers and volunteers not visiting homes of persons who are symptomatic or testing positive for COVID-19. You'll see calls for cleaning of high touch and high traffic areas, including pulpits or podiums, donation boxes, altars, pews, microphones or music stands or instruments, and other things like prayer books, hymnals, cushions, and prayer rugs. All of those sort of things where you have high touch or high traffic areas, there's good suggestions and there's good reminders that those are the places where you could have community spread. That's where you could have COVID-19 transmissions. Those areas should be designated for cleaning routinely in between services, or to the extent that they're not central to a religious practice, maybe even removed from a facility or from a service. Along the same lines, you'll see calls for cleaning of religious garments and linens after each service or event, and doing so under hot water settings. You'll see mandates about discontinuing passing of offering plates and other similar items which move between people, and suggestions for alternatives such as secure drop boxes or digital touch-free offerings. So there's some things to think about there as well. There's a lot of calls for social distancing among employees and members of different households who are coming to your place of worship. There's suggestions around pew markings, signage around your facility, and even reconfiguring of the seating or pews to ensure that people remain socially distanced when they're coming for worship. There's recommendations or suggestions around shortening services or sermons to limit the time that people are spent at the facilities or in a place of worship, particularly if it's indoors. There's, again, recommendations around limiting the touching that's required for religious purposes. So, holding hands during prayer. There's recommendations around limiting that to people of the same households, discouraging handshakes, hugs, or other similar greetings that would break physical distancing during a service. Calls for the removal of communal religious water containers such as fonts or sinks or vessels, replacements with low community touch alternatives, or even changing of the water between uses and protective equipment when there's a possibility for contaminants or splashing where you've got water, because that's a large area or an area where COVID-19 could spread easily. There's even suggestions around reconfiguring parking lots to limit social distancing, and if you're having outdoor drive-in services, some suggestions around spacing vehicles so that people of different households aren't pressed in together. And finally, there's some calls from discontinuing food service around a service and even during a service, and a call to modify practices specific to particular faith traditions that would spread COVID-19, kissing ritual objects, offering communion by hand, and some suggestions around alternatives like using prepackaged materials for communion, or placing it on someone's hand as opposed to placing a communion offering on someone's tongue. So go to those industry guidance and take a look at those. And as you're building your pandemic preparedness plan, those will provide you some recommendations. They'll also highlight some of the mandates that are specific to religious organizations and employers as you're putting these plans together. And then finally, in California, maybe the most recent and newsworthy of developments is the passage by California OSHA, our state agency, on emergency temporary standards. So in addition to repeating the calls for COVID-19 prevention programs, employee notifications, reporting of positive cases, things of that nature, the emergency temporary standards introduce a further and additional requirement that employers must now offer testing to employees at no cost and during work hours after a potential COVID-19 work exposure. And if you find yourself qualifying as experiencing an outbreak, which again is 3 lab confirmed cases within 14 days, you must provide that testing at least weekly until you no longer qualify as a outbreak. So to summarize what we're talking about here, let's look at what you need to be doing around a pandemic preparedness plan, whether you're in California or outside of the state. First, you need to identify and mitigate any site-specific COVID-19 hazards through engineering and administrative controls. Some of the resources that we've already talked about will help you identify some of those site-specific hazards and some of the ways that you can go about mitigating them, either by pulling certain things out of your religious practices or providing alternatives, putting up physical barriers, instituting policy changes, modifying the timing, the number of people that are coming into your facility for services. All of those sort of things are engineering and administrative controls that you can put in place to mitigate the spread of COVID-19 among your working staff and your volunteers, as well as the public as they're coming in to worship if you are reopened for worship or as you're reopening for worship. Secondly, when you're doing that and you're putting all of this plan in writing, establish cleaning and disinfecting protocols. So when you identify those high-touch areas, it may be hymnals, it may be pews, it may be an offering box, something along those lines in the church facility. It may be a copy machine inside the workplace. It may be an area where people congregate before and after Mass, or childcare is being provided. Any of those places where you're identifying high traffic, high touch, those are places that you're going to want to routinely clean, and you're going to want to set those protocols in your plan and lay out how you're going to accomplish that. Thirdly, you're going to want to institute social distancing measures. Again, some of this will be done through your engineering and administrative controls that are site specific. Some of it's going to be the way you lay out pews, how you allow people to socially distance during services. Some of it's going to be in your workplace. Do you close break rooms? Do you stagger people's shifts so that they're not all working at the same time? How can you limit the amount of time that people need to spend time together within 6 feet of each other? Third, mandating face coverings. Generally speaking, this is a good practice in California. It's the law. That's something that you're going to want to fold into your pandemic preparedness plan, and also include a mechanism by which those sort of face coverings can be provided to people who forget theirs or don't have one when they come in for worship, or if an employee doesn't have one or their mask breaks or something happens to it during the workplace. So have that sort of backstop in place. Next, I would say would be training employees on COVID-19 risk and spread mitigation. In California, it's the law. It's required. You have to train employees on this. Outside of California, I think it's just good practice. And we'll talk about some resources that are available to do that. Next would be setting procedures to investigate and respond to COVID-19 cases. So, and we're sort of moving away from the traditional pandemic preparedness plan pieces, and now moving into some of the stuff that we've seen more recently as we've seen more community spread, as we've seen more cases coming into the workplace. We've seen more employers having to deal with these issues inside of the facility. And we've seen, at least in states like California, additional laws coming on the books that spell out specific obligations that employers have. So understand or set a procedure for what you're going to do when you find out that an employee has COVID-19. Who's going to be the person responsible for talking to that person? Learning where they spent time in the office, learning who they may have spent more than 15 minutes around within 6 feet, so that you understand if there are other people that have been exposed. Understanding when they were diagnosed, when they had that positive test, so that you can set into place the isolation or quarantine measures and having a process to document that. Excluding infected workers until they're no longer COVID-19 positive and presenting a risk. That goes along the lines of your administrative controls and putting policies in place about providing employees time off, keeping them outside of work. But it also is part and parcel with investigating and responding to COVID-19 cases. But have it in writing as to what you're going to expect of employees. Go back to the CDC guidance, look at your state guidance for when employees should be staying away, and have that stuff laid out so that you have a roadmap to follow when those cases arise. In a state like California, you're going to need to establish testing for exposed employees. So if you do have a workplace exposure and you do have somebody that's exposed to a coworker that's COVID-19 positive, have some planning in place for how you're going to provide testing during work hours and at no cost to that employee. Some employers have brought in third parties to do that on site. Other employers have paid for employees to go to a clinic nearby to take that testing. Some of that's been clinics that are attached to your insurance plan. Others have used free sites that are available for the public. Either way, it works. You just have to make sure that that's in place, that it's communicated to the employee, that they're doing so under working hours, they're being compensated for the time, and that they're not incurring any testing as a result of that. And then finally, record and report serious illnesses and fatalities connected to work-related COVID-19 cases. That's something that's been codified in California, but understand that outside of California, COVID-19 and illnesses related to COVID-19 are potentially work-related illnesses, and if they're serious illnesses or they're resulting in fatalities or hospitalizations or other serious illnesses, they qualify as a reportable or recordable injury, no different than any other causation. So you have to be wary of whether or not you have a recording obligation, and if an injury takes place that reaches a threshold, do you need to be reporting that to OSHA as a workplace fatality or not? And as those arise, you can dig into those resources and reach out to counsel if you have questions about that. But OSHA has published its own guidance on those issues and talked about when and how COVID-19 illness is a reportable or a recordable incident. And here in California, we've done that as well. Beyond the federal and state authorities that we've already been talking about, understand that the Insurance Board has some really great resources available for you to use as you are conducting and laying out and documenting your pandemic preparedness planning. If you go to the COVID-19 resource page, you will find links to the federal and state guidance that we're talking about here today. You'll also find some really nice informational articles with ideas about the things that churches can and should be doing to protect their employees and their congregants who are returning to work and returning to worship. There's a returning to worship information page, which again provides substantive suggestions for churches as they're going through their reopening planning. For those of you that have not already seen it, we did a very nice COVID-19 return to worship video where we talked about church planning. We talked about return to worship pandemic preparedness planning and outlined some of these types of suggestions that you can and should be thinking about as you put these sort of plans together. For those of you that are required to or want to provide training to your employees about what COVID-19 is, what the symptoms are, what they need to do if they determine that they have a fever or that they have COVID-19 symptoms and need to stay away from the workplace, and the things that they can do inside of the workplace to prevent or mitigate the spread of COVID-19. All of that's been put together for Insurance Board members, and you can access that employee training on the resource page as well. And finally, we have a new resource. It's a COVID-19 planning worksheet and model plan that walks through what we're talking about today, talks about the federal and state guidance that's available, and provides a copy of the model plan that was published here in the state of California that you can use as you walk through your site-specific planning and talk about and document the ways that you want to mitigate the risk, investigate and respond to cases when they arise in the workplace, and plan for some of the things down the road like testing or isolating workers when those sort of issues arise. Again, I would say for anyone watching this video, regardless of whether or not you're in California or not, beyond the federal resources, you have to look at your state resources, and then also be sure to look to see if there's anything that's a municipal or a local requirement that impacts your planning, either through suggestions or requirements for people that are either returning to work or reopening a facility for worship. So now that we've talked about pandemic preparedness planning and rounded out that discussion, we wanted to talk with you a little bit about what else has been going on surrounding COVID-19 legislation and employee benefits, so that you have a flavor for what the law now is and where things are going, specifically as it relates to vaccines. First, let's talk about the Consolidated Appropriations Act that President Trump signed at the end of 2020. That act updated the guidance for the existing Paycheck Protection Program loans that were taken out in 2020 and authorized another round of about $284 billion in PPP loans, as they're known now, in 2021 for new borrowers and other borrowers who took what's often described as a first draw PPP loan in 2020. Most of the terms of the PPP loans are the same, including the interest rates, the terms, the fact that no personal guarantees required, no collateral is required, and these are backed 100% by the Small Business Administration, the SBA. The second draw PPP loans are available to borrowers who employ no more than 300 employees, which is down from the threshold level of 500 in the original round of COVID relief, or meet other alternative size standards. And they also have to have used the entire amount of their first PPP loan or be slated to use such amounts. And finally, they have to have had gross receipts during Q1, Q2, or Q3 of 2020 that were at least 25% less than the gross receipts from the same quarters in 2019. There's some allowance to use financial data from the fourth quarter of 2020 if there's an application after January 1 of 2021. Beyond the extension of the PPP program, and really I think of most interest for the folks that are watching this program, are the extension of unemployment benefits and enhancements. The Act extended the Pandemic Emergency Unemployment Compensation Program for those individuals who are eligible but have exhausted state benefits. The PEUC, as we've come to describe it, the PEUC program extends out to March 14th, 2020. Practically speaking, that may result in some benefits being paid out into April. But generally speaking, the PEUC claims, which had been set for 13 weeks of benefits under the original round of COVID relief, have now been extended out to 24 weeks of benefits. The Act also extended the Pandemic Unemployment Assistance Program for those who are not otherwise eligible for unemployment benefits under state programs, and those the Pandemic Unemployment Assistance Program was also extended out to March 14th, 2021. The Act reads to run the benefits back from the original effective date of the CARES Act, that first round of relief. So those PUA, or Pandemic Unemployment Assistance claims, now can run 50 weeks when they originally were slated to run 39 weeks. And finally, much reported was the extension of the Enhanced Pandemic Unemployment Compensation program. And that's for individuals who are receiving state unemployment benefits. There was an additional amount of $600 per week that was being paid to them as provided in the original stimulus package. That program has been continued, but the per week enhancement is now only $300 a week. Those enhanced payments are effective for weeks of employment beginning after December 6, 2020, so starting in January of 2021. And like the other extended pandemic unemployment programs, those are going to be continued out through March 14th, 2021. States have done a fairly good job of rolling that into their state programs. Most of them have folded it in to the extent that you're communicating with your employees about what their benefits are. For example, if they have a COVID-19 exposure and you're encouraging them to stay away from the workplace, those are the sort of things that you're going to want to be communicating to them as you're having them stay away from the workplace in isolation or quarantine. Beyond all of the news about what was extended, let's talk about what was not extended. The Appropriations Act did not mandate that the Families First Coronavirus Response Act, the FFCRA, paid sick leave benefits be continued into 2021. However, in sort of an interesting wrinkle, it says that if an employer continues to provide that paid sick leave benefit, they can enjoy the tax credit for having paid out those benefits. So employers have a choice going into 2021 as to what they want to do. For those of you in California, I would note that we enacted our complementary law, which was AB 1867, which added a section to the labor code that applied to employers with over 500 employees to provide FFCRA paid sick leave like benefits here in California. So here we had both under 500 that were covered by FFCRA and over 500 which were covered by 1867, providing those paid sick leave benefits. By its operation or its wording, AB 1867 does not continue if FFCRA doesn't continue. So because FFCRA sunsetted, so too did that requirement. But I would also add another layer to this, which is, again, always look at what your local governments require, because there are several local jurisdictions here in California, including the city and county of San Francisco, the county of Los Angeles, and Sacramento County, who passed their own supplemental paid sick leave ordinances in 2020, and seeing what was happening here, they expressly extended those obligations into 2021. So even though the federal government or the state government may not require it, your local government may require paid sick leave benefits be offered to your employees. So keep an eye on that as well. Let's also spend a minute or two talking about workers' compensation in the current environment. Generally speaking, we have and will continue to see workers' compensation claims coming in arising out of workplace exposures, and it would be a very good thing for you to do to be keeping apprised of what's happening with your state and local governments related to this subject. Some states like California have passed laws that actually impose presumptions around workers' compensation claims and COVID-19 transmissions. What does that mean? If a person meets the pieces of the test, they are presumed to have suffered a workplace injury. They are presumed to have contracted COVID-19 from work, and therefore their medical expenses and injuries are presumptively compensable through the workers' compensation system. Here in California, SB or Senate Bill 1159 was a law that did that. We'll talk about the newer injuries. It sort of talked about older injuries, but most of those aren't going to be really what's coming up now for you. For injuries that arose from July 6, 2020 and beyond, there's now a rebuttable presumption that a transmission of COVID-19 is work-related and compensable when, among some other things, the employee tests positive within 14 days of performing labor or services at their place of employment at their employer's direction during an outbreak. And you've heard me use that term before today. Here in this context, it's a very similar definition. An outbreak is defined as a 14 calendar day period where an employer with 100 employers or less has 4 employees test positive, a little bit different number, and employers with 100 employees or more have 4% of their employees test positive, or a specific location is ordered to close by a public health department. That presumption is rebuttable through evidence of measures taken to reduce potential transmission in the workplace or evidence of the employee's risk to exposure outside of work. And you have 45 days from the date of a claim to gather and submit evidence, or the claim is presumed compensable. As I pause there, it should really become clear why doing pandemic preparedness planning in this context is very important, because if you've done a site-specific risk assessment and you've eliminated or mitigated the risks and the areas where COVID-19 spread could occur, and you've documented that, and you've done some investigation in response to an individual coming forward with COVID-19 or a positive test for COVID-19, that's where you're going to be able to figure out whether or not this really is a case where somebody likely or more likely got COVID-19 from an outside the work exposure than inside the workplace, and be able to push back if need be on a workers' compensation claim. If you don't do those sort of things, if you don't document it, if you don't respond to the case as it arises in the workplace, it's going to become very difficult to overcome presumptions like that. Or if you're in a state where you don't have a presumption, combat the claim in the first place either. In California, SB 1159 also added some additional reporting requirements. Yes, take a deep breath and let that soak in as well. If you know or should know of an employee testing positive for COVID-19, you must report that exposure to your workers' comp claim administrator within 3 days. Now, you only have to report that you had an employee test positive, the date that the positive test was collected, the location where the employee worked, and the highest number of employees that were working at that site in the past 45 days. You do not and should not report personal information about that employee or those employees unless and until they actually file a workers' compensation claim. The other piece of this that I want to talk about is a growing concern and discussion around workers' compensation claims for individuals who are working from home. As we've mentioned, employees can and are making workers' compensation claims alleging that they contracted COVID-19 at work. And those presumptions that we've talked about make it easier or presumptively easier to assert those sort of claims. And causation and whether or not the individual transmitted or caught the virus at work is really the call of the question when you get those sort of claims. But a tougher analysis is going to arise when you have an individual that's not coming into work every day and contracts COVID-19 and makes the claim that they've contracted COVID-19 in connection with their work. I would note that in California, the Senate bill that I discussed, SB 1159, establishes that rebuttable presumption for COVID-19 transmissions only when they occur in the workplace. And specific place of employment, that's the phrase that you find in the statute. It is defined as a building, a store, a facility, or a field where an employee performs work. An employee's home is specifically excluded unless the employee provides home health care services to another individual in his or her home. So in the context of a church, that's probably not going to be the case. In other states, we've had a case in New York already where the appellate court refused to set some new standard for work from home employees. And they said, we're just going to rely on our existing principles, focusing on the nature of the activity that led to the injury to determine whether or not an individual contracted COVID-19 at work. Notably, that court said that if an employee is regularly working from home, the home could be treated on par with a traditional workplace. So it's not just a de facto denial of that sort of a claim. If you do have people that are working from home, keep an eye on that. You might want to do some planning or implement some policies around that to ensure that they limit their own exposures, particularly if they're the type or kind of employee that will not only be predominantly working from home, but also visiting other people in the community or meeting with members of the public in connection with their job, making sure they're taking precautions to not contract COVID-19 while they're doing that part of their job. So before we close for the day, we wanted to spend a little bit of time talking about vaccinations and specifically how that might impact us as employers of our church staff. The question of the day is really, can employers require employees to be vaccinated? This is a little bit of an academic question at the moment because vaccinations, at least at the time that we're shooting this program and likely presenting it in its original broadcast, we don't have the vaccination widely available where you could mandate that every single person go out and get the vaccine and they'd be able to actually do that. Certainly certain members of your staff, if they meet criteria around age or pre-existing conditions, or maybe they have volunteer services or have other jobs where they work in healthcare or would entitle them to be able to get access to a vaccine under your state's program. But by and large, it's not generally available. So there's some time to plan around this and really figure out what you as a religious organization want to be doing. But the short answer to that question is generally going to be yes, employers can require employees to be vaccinated. We've seen already the Equal Employment Opportunity Commission, the EEOC, publish some guidance around this question. And they have indicated that under the FDA's emergency use authorization, and as long as an employer complies with the Americans with Disabilities Act, Title VII, GINA, which is the Genetic Information Non-Disclosure Act, that an employer can be allowed to mandate the use of a vaccine. And their guidance actually says the EEOC will not interfere with or prevent employers from following those guidelines and suggestions from the CDC or state or local public health agencies about steps they should take regarding COVID-19 as it relates to the vaccine. For those of you that are familiar with the concept of medical examinations and some of the prohibitions around medical examinations or how that can become very complicated for an employer that requires or calls for a medical examination as part of employment, rest assured that the EEOC has clarified that the vaccination itself is not a medical examination under the Americans with Disabilities Act, because administration of the vaccine does not seek medical information about an individual or their current health status. Note that pre-screening questions about an employee's health could implicate that, and so that's something that you should not be getting in the business of doing. So that's the general simple answer, which is yes, but it comes with a but, and let's talk about what that but or what those buts might be. So the first area where there may be an exception where an employer is trying to mandate a vaccine is the arena of disabilities and reasonable accommodations. Under the Americans with Disabilities Act or a state equivalent statute, an individual may be suffering from or have a qualifying disability, and that disability may prevent them from actually taking the vaccine. If that is the case, an employer needs to engage in the interactive process and potentially offer a reasonable accommodation to that individual and potentially exempt them from the vaccine mandate. Now, that is not to say that an employee with a disability who can't take the vaccine must then be allowed back into the workplace with everybody else who's had a vaccine without any sort of additional thought. An employer might be in a situation where they could exclude that employee from the workplace if their being unvaccinated presents a direct threat to other workers and the employer is otherwise unable to provide a reasonable accommodation that would reduce or eliminate that risk to other employees. Currently, where we are with the level of community spread and the way that most regulatory agencies and courts have viewed COVID-19, they view COVID-19 as a direct threat. But understand that over time, if the community spread goes down, the impact of the virus goes down, the prevalence of individuals being vaccinated goes up, it may move away from a situation where the severity of potential harm, the likelihood of harm, or the imminence of potential harm to other employees is reduced so that it doesn't really present that direct threat. Understand that when you're in a situation where you're asking people to be vaccinated, and somebody comes forward and says, "I can't take a vaccine because of a disability," and you're going through that interactive process to determine what you can or can't do. If you determine that you can't bring that person back to the workplace without any other steps, you have to also think about, are there other things that you can do by separating that employee from others, maybe providing them a separate workspace or dividers? Maybe they can work from home. Are there other things that you can do to allow the individual to continue to work and perform their essential functions or their essential duties, notwithstanding the fact that they're not getting that vaccine? So you have to go through that entire process before you end up on the other end of saying, you can't come to work, or potentially, we're going to have to put you on a leave of absence, or maybe even we can't have you working here for the time being under the circumstances. So there's a lot to be sort of unpacked there, and you really need to work through as you're dealing with persons with a disability. The other area where you're going to potentially find yourself providing an exception to a vaccine mandate would surround religious objections. If an employee objects to a vaccine because of a sincerely held religious belief or practice, you need to go through an interactive process and provide reasonable accommodations to the extent that they don't pose you an undue hardship. Now, most of you are going to find yourself in a situation where the individuals that are working for you are likely going to be members of your congregation, and so you'll be very familiar with their religious beliefs and whether or not imposing a vaccine or taking a vaccine is markedly inconsistent with your religious sex professed belief. However, that may not be the case. You may have others working for you, and so you may have to go through this analysis in figuring out whether in the first place they have a sincerely held belief. And that's a conversation that you need to have with them. And when you're determining whether or not the religious belief is sincerely held, you have to ask yourself whether or not the employee has behaved in a manner consistent with that religious belief in the past, whether what they're asking you for in terms of not taking a vaccine is consistent with their secular belief, and whether there's any timing of the request that renders it suspect, and whether or not you have any other reason to believe that the accommodation is not sought for religious reasons. There's a bunch of things that you have to take into consideration here. We probably couldn't come up with all of the different types of religious beliefs that might come forward, but understand that there are a wide range of religious beliefs, religious tenets that are accepted. And so you have to work through and determine whether or not there is a legitimate religious religious belief underscoring the request, and whether the individual sincerely holds it before you determine whether or not it would impose an undue hardship upon you to accommodate them by not making them take the vaccine. In this context, I would mention that generally speaking, simply being against vaccines is not a religious sect or belief. So you could have somebody whose religion is not saying that taking a vaccine is something that they shouldn't be doing, who, separate apart from their religion, doesn't believe in vaccines, believes that they provide a threat to those that take the vaccines, that there's some medical downside to doing it. And there's plenty of conspiracy theories abounding in the context of the COVID-19 vaccine around what may be in it or may not be in it. Simply being anti-vax is not a religious belief. So if that's what's being presented to you and you are mandating a vaccine, that's an area where you could push back. If you have somebody that has a legitimate, sincere religious belief that prevents them from getting the vaccine, you'd fall back into a reasonable accommodation discussion with them that's not unlike what we discussed in the context of somebody with a disability. And you'd have to figure out whether or not there are things that you could do to allow them to come back to work without the vaccine in terms of physical distancing, physical barriers, shifts, staggering shifts or schedules, putting them maybe in a remote or work at home arrangement, things like that, where you could continue to have them employed, performing the essential functions of their job with those accommodations. If you can't do those things, consider whether putting them on a leave of absence for a period of time is something that you could do before you get to the step of saying, we just can't have you working here anymore unvaccinated, and terminating them so that you make sure you comply with federal and state laws around accommodations. One of the other questions that we get around vaccines is documentation. If you're not providing or administering the vaccine, and in today's current state, you wouldn't be the one doing that, can you ask an employee to provide documentation or proof that he or she received the vaccine? And generally speaking, the answer there would be yes. Be mindful again, though, that if you are having conversations with individuals about the vaccine and they are indicating to you in that context that they haven't gotten the vaccine or that they are questioning whether they'll get the vaccine, be very mindful about asking them questions about specifics of why they aren't getting the vaccine or haven't gotten the vaccine, because that may then lead to disclosures of information about medical conditions. It may start to delve into the arena of a medical examination, and it may reveal ADA limitations or restrictions that you otherwise wouldn't otherwise have had to consider. So yes, you can require that proof, but if somebody doesn't quite have it yet, you can just simply say, we need it if you're mandating it. And if they don't, then at that point, rather than asking them why they're not getting it, you might just simply say, do you need an accommodation? Generally to see if they have something to tell you, as opposed to getting into medical inquiries about their personal health situation. A final question that we often get around the vaccine is, can I fire someone if they refuse to be terminated? And there, I think it's probably clear by now, the answer is yes, but there's a but. We've talked about what those buts are. Do not get to the point of terminating somebody until you've already gone through the interactive process. If the reason that they are refusing to take the vaccine is tied to a disability, a medical condition, or a sincerely held religious belief. But if you do get to that point and you do have a mandate in place, yes, you could terminate the employee. Now, this all leads me to sort of a final thought around vaccines, which is, do you want to be mandating vaccines in the first place? and understand that if you make vaccines a term and condition of employment and you require someone to have a vaccine before they can remain employed, there are many places in this country that will say you then need to pay for the vaccine, you need to provide the vaccine, you need to allow them to be paid for the time that they're conducting the vaccine. And it may put you, as you can sort of see today, into situations that you don't want to be in, particularly as we get further along in the vaccination rollout and, God willing, the community spread of the virus goes down. You may find yourself in a situation where you don't feel as compelled to have a vaccinated staff, or you might feel that you can encourage it but not mandate it to get away from some of those wage and hour issues and pull yourself out of some of these discussions where you're having to make exceptions to the rules and get into people's medical conditions or disabilities or religious beliefs around this issue. So several employers that we've worked with have pulled back from the mandate because they don't feel that there's a compelling reason to have a fully vaccinated staff yet. But they have certainly encouraged it, and they've provided resources and education to staff about where they can get it, and allowed people to do it on their own. In some instances, even offering that where employees do provide or do get the mandate, that they'll provide pay during the time to get it for those employees, or even facilitate those tests when they become available. So it may be something that at the end of the day you determine this is not something we want to mandate, but we'll strongly encourage and educate our employees so that they can go out and get it on their own. So that'll do it for today's program. Thank you again for joining us. Please continue to come back to the Insurance Board's resource pages to find information like this that will help you continue to monitor your own pandemic preparedness planning, help you keep it up to date with the current thoughts and understanding around COVID-19, and beyond sort of the suggestions of how to operate safely, return to work and return to worship safely, the mandates that you're under as you do that, and continue to watch the law as it develops around some of these employee benefit issues so that you're communicating with your staff about all the things that are available to them to encourage them to stay at home, stay away from the workplace, stay away from your church when they do contract the virus. Wish you all good health and good luck in the days ahead, and look forward to joining you on our next Insurance Board program.